Approximately 7 weeks from resection of the ilioinguinal, iliohypogastric, and genitofemoral nerve. This was performed for a history of right-sided groin pain. This began after an inguinal hernia repair to fix a hernia that was present. The hernia was fixed, but he had pain in his groin, and we're now about 7 weeks from that. Can you tell us a little bit about what your pain was like prior to the removal of those nerves and what you were experiencing before we took those out?
Well, after the hernia surgery, I had intense pain. I'd say around 8 for at least 7, 8 months until this surgery. I could hardly walk, couldn't sit, couldn't lift. It was a real rough time for me.
And where approximately was your pain? In the groin? And
always in the groin area on the right side, and it was very intense.
Okay. And we did a nerve block that helped temporarily, which meant that we thought we could help you. And so about 7 weeks ago, we took these branches out. And how does it feel now?
Compared to where I've been, the pain is actually 95% gone, and I hardly have any issues at all. I feel great. You did a great job, and I appreciate it.
All right. Thank you very much. The ilioinguinal and iliohypogastric nerve are these nerves coming here in the groin that get stuck in hernia mesh sometimes. And the genitofemoral nerve comes down here into the scrotum and testicle region. And some of these patients, male patients, will have testicular pain after their hernia repair, whereas in females, they can also get this pain, and the ilioinguinal nerve comes into the groin crease, and the genitofemoral nerve into the pubic mound here.